Hello and welcome to Open. I'm Rhina Valentin, your host of Café con Leche for the next hour. We're encouraging you to get social with us, especially during these social distancing times. Tweet us and follow us on Instagram at BronxNet TV and like us on Facebook at Open BronxNet Television. And of course, while you're there, follow moi on Twitter, FB, Instagram, Insta Stories, and LinkedIn at Rhina Valentin. So our first guest is an assembly member, a mother, and a registered nurse who has been juggling all three of these hats while serving on the front line to help the Bronx community during this crisis. Although the COVID cases seem to be slightly decreasing in some areas, the health disparities in the Bronx are still prevalent. And joining us to tell us more, please welcome Assemblywoman of the 87th District, Karines Reyes. Hello, Karines.
Hi, Rita. How are you? ¿Cómo estás?
Karines.
Sí.
I'm good. How are you?
I'm well. I'm healthy, and that's a blessing. So I am well.
Well, first, I want to applaud you and say thank you. Thank you for choosing to put on that Superwoman cape and jump into the front lines after already being in a position as an assemblywoman. Apparently you're a nurse first, rather you're a mother first and then a nurse, and then serving the your district. So let's talk a little bit about what made you decide to do that.
Well, and the Bronx has been one of the hardest hit areas in New York City in terms of COVID-19. And particularly early on in this pandemic, late March, they were asking for health professionals that were either retired or no longer working to jump back in. And for me, this was the opportunity to, do my part, put in my little grain of salt in a way that it was different and that I felt really touched the lives of the people in my community. And that's by going back to my first career as a nurse.
And so you are still on duty. And when did you decide to jump back in?
Late March. I want to say my first shift was March 27th or 28th. I can't remember exactly, but it was that weekend that I went and started working my shifts again.
And so are we now? How's it looking in the hospital?
Definitely better. This past weekend, they didn't need me all weekend, which was a good relief. To hear that they had enough staff, and that is a very good sign for the Bronx and for our hospitals. Unfortunately, like you did mention, the healthcare disparities are still prevalent, and that's something that we have been contending with for many, many years. And I think that this current pandemic has really brought to light what we in the Bronx have been sounding the alarm about for a very long time, that our health is not equitable. It's not. There's no equity in our healthcare, and our disparities are huge, and that we need to look at how we address health outcomes in the Bronx in a very different and unique way, particularly after this pandemic.
So, how has serving as a nurse contributed to your position as an assembly member in being a voice for that?
Well, my healthcare background has always informed my work as an assembly member. I think it's important that we continue to advocate for the expansion of healthcare. I see healthcare and healthcare access as a human right and not a privilege, and it should be afforded to everybody, regardless of their ability to pay, whether they're employed or not employed, and regardless of their immigration status. Because the reality is that when our communities are unhealthy, the disparities are so much more than just health, right? It becomes something that is really touches the lives and every aspect of the lives of people in our communities. So we should always look at health first, and I think that has always informed my policy and my drive for serving the community as a legislator.
So let's talk about the preventional aspect of it, as well as the differences in insurance coverage, because that's what this conversation is about.
Right.
It just baffles me that people are going to be treated differently based on the insurance they have and the type of coverage they carry.
Yeah, and many people in our communities for years have chosen how they access preventative primary care based on their coverage, because just because you have coverage through an employer doesn't mean that that is total and covers everything. So for many people, even a primary care visit or a well care visit for their children or themselves requires a copay that oftentimes they cannot afford. We have a lot of employees who pay almost $200-$300 a week or every 2 weeks for healthcare coverage, and on top of that, they might have copays and deductibles, and that is really because we have a for-profit driven healthcare system in terms of health insurance coverage, right? And we need to look at how we make that a public system that is not profit driven, that covers everyone the same, and everybody has access to care regardless
Right.
of what that looks like.
Right. And the same goes for pharmaceuticals, right?
Absolutely.
Yeah. And so my next question is with regards to this antibody testing. So what is your opinion on that matter, and how important is it for people to be tested, and what exactly are we gaining from having everyone test?
Well, this novel virus, there are a lot of uncertainties with it, right? And even with antibody testing, the scientists have been saying that we don't know yet what type of how much antibodies in the blood really translate into a true immunity, whether that protects you from reinfection. There's still a lot that we're learning as we go. It's important to know if people do have antibodies, it lets us know that they at some point were infected with the coronavirus, but that doesn't mean that they are in the clear and that they can't get infected again. And I think that it's important for us to continue to practice all the precautions in terms of not getting infected with the social distancing, wearing a mask, washing our hands often. And for me, hand washing is the most important aspect of this. I think people get a lot of false sense of security when they're outside wearing gloves, and gloves still contribute to cross contamination. I think it's important that people really practice good hand washing. That's before they put on gloves, and especially right after they take them off.
Wonderful. Lovely, lovely, lovely notes taken, and really all going back to basics. And we want to thank you for taking the time from wearing all these multiple hats. Once again, happy belated Mother's Day.
Thank
And
you.
I'm happy you were able to take the weekend off and celebrate your Mother's Day. And thank you once again for being here with us.
Thank you.
All right, you guys, once again, for more on Assemblywoman Karines Reyes, please make sure to follow her on Twitter at Karines Reyes NYC. We do have to take a quick break, but when we return, we'll discuss mental health and COVID-19. Don't go anywhere.